Before I arrived, I would say Walker was just a small community in northern Minnesota. It's about 1,500 people population. We had kind of a rotating contingency of physicians who were here maybe 1 or 2 days a week, which made it a little challenging for patients to have a lot of ongoing care with any one doctor.
What we've noticed is that every time there's an emergency, there are no doctor's office open.
I think rather than being seen on an annual basis, people would be more likely to put that off or come in only for more urgent care type situations.
Well, we're an underserved area, and Walker is one of our examples of that, where there's not enough physicians to meet the needs of the entire population there on any given day.
Of a patient who really stuck with me is an elderly woman who I had seen her probably only 3 or 4 times just for regular care. She was in fairly good health, and I had actually been gone for about a month because my mother was very ill and passed away. And when I came back, about 3 or 4 weeks later, this woman came in to see me, and she had been seen by my partner while I was gone. And she had come in and was very sick with a cough and had been losing weight and all these symptoms of probably some sort of a cancer. And sure enough, he had ordered a variety of tests, and she came in to find out the results of her tests from me. And it was a very challenging conversation to have with her and her husband. But I think because I knew them and because of my experiences I had just gone through with my mother, I was able to really provide a lot of support for them emotionally, and also be able to, tell them in medical terms what was going on and what the expectations would be, and what she needed to do next, and all that kind of stuff. And as it turned out, over the next month or so, she basically found out that her cancer was terminal, and we had lots of conversations about hospice and had good conversations with her and her children and their family, and I was able to really help them through the process of dying, basically. And that was very rewarding in a lot of ways.
It has to do with cost of going to medical school. And for primary care physicians to go to medical school, they're probably one of the lower paid physicians coming out of training. They still have the same amount of loans as those experts that might go into fields where they make more money.
People who probably would have been very happy as primary care physicians in a rural setting, and I think probably would have been very good at it as well, but yet felt somewhat obligated to try to have more income in order to pay off their loans, provide for their family, things like that.
So they can't pay off their loans. And so a loan or a grant from any organization that will help bring a person into a need area is a great benefit.
And I can't emphasize enough how important these loan forgiveness programs are to rural communities. Rural communities just wouldn't look the same without access to physicians.
In my opinion, is one of the best programs I've ever read about or participated in or heard about in terms of how it encourages young physicians to practice in areas of high need.
The overall quality of life would definitely be different, and I think in general these communities wouldn't be a destination like they so often are, especially for retirees and individuals looking for a different pace of life, but not necessarily a change in the quality of life.